I think there are right time. Maybe it's not very appropriate measures today because it's maybe too light for some people like restaurant and others. But I would say that today the big issue here is not much the virus, but more the tired of the people here.
Let's see. Well, let's talk about how people have been affected by it and are going to be affected. Because do you think France should have adopted perhaps a relaxed lockdown approach, similar to what it does with school holidays, where different regions are allowed out at different times, or at least the children are?
Yes, I think for the measures of lockdown, one of our problem here would be to maybe to focus on the people that need it the most, because today I have seen a lot of people sick in my practice office, and I would say that for this time it was not as bad for the sick people. We know now how to manage them out of the hospital. We know how to manage them in the hospital, so it made the rise of people in the hospital not as high as the first time, but I think we would gain a lot if we would focus on the people that need it the most. Yes.
Okay, well, let's talk about the people. And we've seen in the past lockdowns, there's always this 2 week rebound before the measures take effect. Do you think
Yeah.
enough precautions have been put in place to prop up the health system here in France?
I think I would say I wouldn't like to be at the government place because it's very complicated. The problem of the virus is not the only problem that they have to manage. The economic problem, of course, is one of them. But I would say, as a doctor, that I see a lot of people in a big distress. The way that the government and politicians are speaking about that virus and the epidemics state is sometimes too. I would say anxious. It makes the people more anxious, and that's a big problem. So I think yes, it would be good if we could see what's happening on the field and not just numbers, because numbers are sometimes too scary.